Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order, so you can make use of it. Thank you very much, my dear friends. As you know, we were discussing about the differences in sexual differentiation or DSD. In the last class, we have seen how the ambiguous genitalia is formed. So today, we will discuss what is normal. Before knowing the abnormality, we should know the normalcy. So as far as the male and female external genital organs are concerned, which helps us to decide whether it is ambiguous genitalia or not, we should know what is the normal status. Now suppose 46XX. 46XX means it is a female, a normal female. Suppose you take a normal female, what is expected at the time of the birth to determine the sex is, in case of female, there should be a visible vaginal opening, must be present. There should be a visible vaginal opening, and slit should be about 3 to 4 mm of length, or a stellate orifice with heaped up mucosa. There should be a stellate orifice with a heaped up mucosa. And what about the clitorius? Clitorius should be only 2 to 6 mm of length, and there should not be any palpable gonads. So this is what is expected, because labia majora, labia minora, basically they're nothing but the modification of the scrotal bag when we compare to the males, isn't it? So what is expected is a visible vaginal opening should be there, and slit length should be 3 to 4 mm, or a stellate like orifice with the heaped up mucosa should be present. Clitorius should not be more than 2 to 6 mm, and there should not be any palpable gonads. So this is what is normal for 46XX female. What is normal for the male? In the male, the urethra should be present at the tip of the glands, and penis should be 2 to 2.5 centimeter length. So this is very important, 2 to 2.5 centimeter length, because anything less than 2 centimeter in the erectile position, so that is considered as a micropenis. Okay, and 2 to 2.5 centimeter length should be there, and 0.9 to 1.3 millimeter of diameter should be there. This is expected for penis in case of male. And most importantly, testis should be present. Testis should be present bilaterally in the scrotal sac, and its diameter is about 8 to 14 mm. So this is now what we say normalcy. At times the testis may not be descended properly to the scrotum. Sometimes it may be in the superficial inguinal ring, sometimes it may be in the inguinal ring or deep inguinal ring, etc. Sometimes one is present, another one is absent or not descended yet. So such a type of minor changes will be always there. So in that condition, what is size of the testis is very important. So that is diameter is about 8 to 14 mm. So that should be present. So this is what is expected for the normal male and normal female. Now when to suspect DSD? This is normalcy, but when you suspect DSD, when there is an obvious atypical development. Okay, so this is normalcy. What is normalcy? Now you understood. But there is an obvious, what you say, atypical development is there. That is one thing. That means labia majora is not formed, labia minora is not formed, clitoris is too bigger. Okay, in case of females I am talking. And the penis is too short in case of males, and there is no testis in the scrotal bag, there is no urethra, like that. So they are all atypical developments. Okay, so that is considered to be the DSD, number one. Number two is bilateral cryptorchidism. That means the descent of the testis is not there. Testis is not descended. Undescended testis is there bilaterally, the both sides. So that is also considered as atypical development. We know that if the testis is not descended into the scrotal tract, what are the two important hormones which are responsible, like the testosterone and all. So that we have already studied. Third one is penoscrotal and scrotal perineal hypoplasia. Suppose if there is a penoscrotal or scrotal or perineal hypoplasia is there, underdevelopment is there, so that is also suspicion towards DST. Similarly, penoscrotal, scrotal and perineal hypoplasia irrespective of testicular descent and unilateral crypto and hypospodiasis. So that's one thing. Then unilateral crypto or hypospodiasis, hypo and epispodiasis, it is related to the ureteral opening in the penis, tip of the penis. Epi means if it's in the tip uppermost to superior, and hypo means to inferior. Another important is clitoromegaly, clitorius or clitoromegaly with or without inguinal hernia and palpable gonads. That is clitoromegaly is suppose if talking about suspicion about the female child, and clitoromegaly is there, which is too big, megaly is taking place, and it is with gonads or it is without gonads, or if it is with inguinal hernia or without inguinal hernia. So this is also atypical development. Okay, amenorrhea with inguinal swelling and discordance with the prenatal karyotyping. Discordance with the prenatal karyotyping. Karyotyping is showing the male, and here the presentation is just like female, or vice versa. So like this, all this presentation, if it is there, then it is considered as to be DST. Now, when we should suspect, basically we should suspect about 3 or 4 things. Number one is apparent clitoromegaly. It means clitoromegaly is too big. Clitoris is there, especially in the females. Okay, so clitoris should be replaced as penis in case of males, isn't it? But now you are not in a position that you, whether it is a penis or whether it is a clitoris. It's not a small clitoris as happens in case of female child, but it is too big. So it creates a confusion whether it's a clitoris or it's an enlarged clitoris, or what is a hypertrophy, what you say, clitoromegaly, or it is penis. So this differentiation is quite difficult. So that condition you have to suspect. Number one, labial adhesion less than 1 year. Labia major and labia minor, so they are adhesed. Okay, and then penile hypospodiasis, opening, and concealed penis. Penis is not visible properly, probably micro penis or mini penis, etc. So these are some of the things which actually make us to suspect regarding the DST. Now, when a child is born with ambiguous genitalia, what should be our approach? Okay, so what should be our approach and how you have to proceed, and that we will discuss in the next class. Thank you very much.